Hey team, how you doing today? So, got a little video about my first response bag. I'm going to show you a bit about what's in it. It's been a wee while since I uploaded a video. Just been super busy lately. So let's get straight into it. At the top, we've got this pouch up here, which carries hyphen chest seals. So these are just used if people have got a sucking chest wound, most likely by bullet or penetration, and it just stops air being sucked into the chest cavity. Got some wipes, extra gloves, got some ice packs, quite a few ice packs, more wet wipes, and Dettol disinfectant wipes. Also got a glow stick in there. So that middle pouch. This top kind of compartment, we've got a cat tourniquet. I've got my Raptor shears. These are actually pretty good. They fold out like that and you can put them away unfolded or folded. You hook that onto your belt if you need be. Some strip saws. I've got a pulse oximeter which goes on the finger and it gets your like pulse and your SpO2. Gloves, another tourniquet. Lots of gloves because you never know how many gloves you might need. Alright, and we'll go down into the main compartment. Open this bad boy right up. So as you can see from the top here, I've got all sorts of goodies. It's got some medicines, pain relief and stuff. I've got a Dettol hand sanitizer, can't go wrong with Dettol. Got some shavers and a set of tweezers. Yeah, needle nose tweezers, shavers for shaving hairy people if you need to expose like a wound better or get something stick. Got splinter pros, which are these like little needle things to get splinters out, which is pretty cool. Got some pens in there, got a pen light, just a handbook. I've got a thick handbook or a pre-hospital emergency care handbook. Going into this pouch here, we've got kind of like your dressings, so everything from like mediums to large dressing sizes. You've got some like abdomen comm bipads. It's like your big, you know, if someone really hurts himself. And you can also cut them up to make them smaller or fold them up to make them smaller as well. I won't stop you from that. This pouch here, I've got a little bit more of stuff like that. I've got some alcohol prep pads for cleaning the wounds, sting treatment, sting relief, and more alcoholic pads. I've also got a scalpel kit. Do come in useful, especially for cutting away awkward things. Mostly for skin, but yeah, they can be used for anything. Got some more pads in here. All sterile, non-woven, so they don't really stick to the wound that easily. But you know, just chuck some water on here, and that guarantees hopefully not sticking. So these are medium size for your like medium trauma, where you have to patch up medium sized cuts. And on the top here is kind of like your smaller looking wounds. So you've got quite a lot of steri strips. So these are like little pieces of tape, and when you've got a cut that's obviously clean and sterile, you know, push the skin together or stick one side and pull it over to the other side to pull the cut together. It kind of increases its chance of healing faster. This is like one of these long strips of plasters. You just cut plasters to size. Fabric's the way to go, team. Never get plastic. These are all fabric plasters in here, adhesive ones. Yeah, that's literally it from that. So that's just like plasters and steri strips. Alright, moving on to the main part of the pouch. So in the top here, it's got some triangle bandages. I've got some a compression sleeve, I think it's called. Yeah, it's like a little sleeve thing you put over your arm or your wrist or a joint that's really sore, and it just puts pressure on the sides of it. It's good for like sprains and stuff if you need a support. Got some Hearing Pro in there. And this next pouch, it's kind of like pain relief meds. So your paracetamol, scissors, burn cream. Got some of those like little, I think they're like 20cc mil. Sorry, 5ml syringes. And I've got Disprin, more paracetamol, ibuprofen, cookies for like stomach pains, and I've got a lot more medicine underneath there. Also Clarentine, good allergy relief. And this part here is kind of like all the saline stuff. So saline, which is salty water, good for irrigating. Like if you get stuff in the eyes, hold the eye open and just squirt softly in there and try and get all that foreign body out. Also good for wetting your gauzes or your what do you call them? Those sterile dressings. There we go. That's the word I'm looking for. Sterile dressings, so they don't stick to the wound. Got some emergency blankets in there. One of the H's in, like, you know, doctors A, B, C, D's, E, F, G, so on. H comes into it, hypothermia for patients. Right, so in this part of the pouch, it's kind of a wee bit spread around and not really like organised properly, but hey, that's I operate, it's pretty effective for me. These are OPAs, oropharyngeal airways, so these like special tubes that kind of go down the patient's, go through the patient's mouth and holds their tongue, so the tongue doesn't fall back onto their across their airway, and cuts that off. And I've just got some bleach in here. This needs to be diluted with water. It's good to go. Got some masks. Got some smaller OPAs for kids and infants. Got some throw uppy bags. I've got a SAM splint, or a conforming splint, or whatever you want to call them. They're really cool. It's basically like a sheet of aluminium or a sheet of bendable metal in there with foam encased around it. So these are great for making splints and supporting those broken joints. Really, really good. Just in this kit here is a BGL kit, a blood glucose. So it's basically like a little machine, and it's got these lancets which you put in this little device here, and it makes like a little pick on your finger. It's like a little needle in there, and then it pricks your finger, draws blood. Put the blood on one of these little microchips that goes onto here, and it just tells you like how much sugar. Hey Marley, how much sugar you have in your bloodstream. It's mostly used for diabetic patients. And this next one here, we've got my blood pressure cuff. This is standard blood pressure cuff, nothing too fancy, so I don't need to get that out and show everyone. Obviously with a blood pressure cuff you have to have a stethoscope. You don't have to, but you know, good practice to have one, because then you can do a lot more stuff like oscillating the chest for listening for you know, any anomalies with the breathing. Also, you know, for blood pressure. That's basically it for that. Yes, hello. D3 strapping tape. Really, really good stuff. You can use it to secure dressings, or you can use it to strap, you know, sprained body parts or sprained extremities. So next part would be my bag valve mask. So that extends like that. Filter goes on the front there, that's why it's so close together. And then the actual face mask piece goes on top, and that's your rescue breaths. Now next part is, it's just another filter actually, med tape in a sharps container. Now because I've got a BGL kit that has its own lancets that are removable for obviously multiple patients, you've got to have somewhere to put those sharps. So I've got a sharps container, so it's basically like a little biohazard container that's designed not to be punctured from the inside or outside or whatever. And it's just a safe place to put all like your sharp things, needles and all that. Yeah, definitely worth having one of them. Got some biohazard bags. I've got some clear Ziploc bags in there just in case, you know, might be someone cuts a finger off or whatever and you need to take your finger with them to hospital. I've got some larger ice packs. I've got an oxygen lead here for hooking your bag mask up to an oxygen cylinder. And obviously if you've got an oxygen lead, you've got to have a reservoir mask which goes on the bottom, just because all the oxygen's going to fill the bag up, and you know, that's it for the interior part of it. Now we move on to the sides. Move all this stuff out of the way. So these side pouches are kind of like your stuff that you couldn't fit inside the bag, really, is kind of how I put it. So it's kind of like your application, or like your gauze to wipe blood away. These Q-tips. Also got some more bandages in here. A lot of the stuff is all bandages, all tucked down in here as well. More gauze. Just like cleaning type wounds and materials. And this next part here, these are more bandages in here as well. I've also got Glad Wrap. Glad Wrap, you know, it's used for burns. If you have major burns to the arms or whatever, you want to put Glad Wrap, a bit of Glad Wrap over it. Not like wrap it around heaps, but just like a layer over it, just to protect it from, you know, bacteria. It's also like an extra layer of skin for the patient, so it's not going to be excruciating pain every time you move them, or when the air flow moves past. More bandages, and all bandages that are all tucked down into here as well. Yay, exciting bandages. And that concludes tour of my first response bag. Background, I'm with the fire service. Correction, I used to be with the fire service. I was in the volunteer fire service for quite some time. And I was quite heavily involved with the ambulance service as well. Now I'm in the army as a combat medic, so this is all just bringing back good memories for me, and that's why I have such an extensive kit, and obviously extensive training goes along with that. Obviously if you have something like this and you don't have any of the knowledge or training, it can be kind of useless in a sense, so you should always get trained in medical to use the high-end stuff, like, you know, tourniquets. And because if you put a tourniquet on someone that's just bleeding like a little bit, you know, you could damage their arm, or they could sue you, or however that works. Anyway, hopefully you guys enjoyed the video. Hopefully I'll be able to post more videos like this one in the future. Give me a thumbs up, subscribe, comment on anything. If you guys have your own kind of style bag, you know, send in some comments in about what I could do to improve, or, you know, any extra things that you think should go in here as well. I have got stuff on the way. This is due for a revamp, so it's not the finished product, so to speak. Everything's always changing. Cool. See you later, guys.